Hi, my name is Julie Kelly, and today I am discussing if face masks are effective against COVID-19. Not many people had heard about the coronavirus or COVID-19 until early to mid-March of this year. The coronavirus originated in Wuhan, China at the end of last year, but the first case was not detected in the United States until January of this year. Unfortunately, in the last 6 months, the virus has impacted not just people in the United States, but all over the world. In fact, there are currently over 10 million confirmed cases of coronavirus worldwide. The virus has claimed over 500,000 lives. In the United States, there have been more than 2.5 million cases and 130,000 deaths. At the beginning of this year, there was not much that was known about the virus. The virus spread so very quickly, and many states like New York and Washington saw a huge increase in cases in their states. Hospitals in New York became overwhelmed, and the state experienced more deaths by far than any other state. In order to protect citizens, many governors across the U.S. requested that their residents shelter in place and stay home as much as possible. Some states did not shut down, but they did limit their services that were available to the public. Due to protection to prevent the spread of the virus, fear from some, and so much unknown about the virus, the economy was greatly impacted. Everyone in the world has been impacted by the virus. Some have been personally affected by contracting the virus or have lost loved ones who have died from the disease. The United States has had more positive cases and deaths than any other country, but it's not isolated. This terrible virus is an international health crisis that has affected global health as well as the whole world. At this time, there is not a vaccine to provide an immunity from the virus. However, the most advertised and communicated ways to prevent the spread of the virus include washing your hands frequently, keeping at least 6 feet of distance from others, which is called social distancing, not touching your face where the virus may enter the body through the nose or mouth, and lastly, wearing a face mask. Whether a face mask is effective in preventing the spread of COVID-19 has been quite controversial over the past few months. The information that was put out in the beginning regarding face masks is now a bit different, thus the reason for some of the confusion. The Centers for Disease Control and Prevention currently recommends that people wear cloth face coverings in public settings when you're around people who don't live in your same household or when it's difficult to remain a distance of 6 feet or more from another person. The CDC maintains that face coverings help prevent the virus from spreading to others, so they should be widely used when you're in public settings. The reasoning behind this is that the cloth barrier prevents respiratory droplets from traveling into the air and onto other people when the person wearing the face mask coughs, sneezes, talks, or raises their voice. This is called source control, and they maintain that evidence from clinical and lab studies show that face coverings actually limits the spread. Because the virus can be spread when people do not show symptoms, the CDC recommends that all people over the age of 2 wear a face covering when in public or when social distancing is not feasible. A study by a team of researchers at Texas A&M University found that not wearing a face mask dramatically increases a person's chances of being infected with COVID-19. The researchers examined how the virus is easily passed from person to person. From trends and procedures in China, Italy, and New York, the team found that using a face mask reduced the number of infections by more than 78,000 in Italy and by over 66,000 in New York City. And they did this over a short time period of about 3 to 4 weeks in April and May. Their conclusion was that wearing a face mask in public is the most effective means to prevent human-to-human transmission. Their desire to send a message to people worldwide that wearing a face mask is essential in fighting the virus. Also, a doctor from Johns Hopkins University responds to some frequently asked questions on their website. One of the questions is about how to wear a face mask. If the face mask is not worn properly, it is not effective in preventing the spread of the virus. In order to be the most effective, face masks should cover one's face from the bridge of your nose to under your chin. It should be loose fitting, but secure enough to stay in place. You should be able to talk with the mask on, and it should be comfortable enough that you are not tempted to touch it or pull at it, which could reduce the effectiveness. They also go on to explain that cloth face masks can be made out of t-shirts, bandanas, or scarves. But something that has 2 layers is definitely the most effective. The information that I just gave you is the most recent information about the effectiveness of face coverings. It's no wonder there is still much confusion in the public. At the beginning of the pandemic, health officials warned Americans that they shouldn't wear a face mask. That was information that was put out at the beginning of March by the CDC and the U.S. Department of Health and Human Services, and also the U.S. Surgeon General. Even a doctor from Johns Hopkins, who we had just quoted, said that most people who don't properly know how to use face masks correctly and properly rush out to get those, and they prevent healthcare workers from obtaining masks, which would be the people who had the greatest need for them. The U.S. Surgeon General actually gave a directive to Americans to stop buying masks and stated that they were not effective in protecting the general public, and that if the general public purchased all of them, they would be putting communities at risk by not leaving enough masks for healthcare workers. The director of the Center for Immunization and Respiratory Diseases said in January that they don't recommend the use of face masks to prevent respiratory illness, and they weren't recommending them at the time for the coronavirus. Instead, they were warning Americans to be vigilant of symptoms and signs of the virus and to wash their hands. Their recommendation was that only people who were displaying symptoms or caring for someone with the virus should wear a mask. Some people who are unsure if a mask is really effective or not weigh their risk on if it's worth it. Also, some people just don't like being told what to do, and they feel like they're being told to wear a mask infringes on their personal rights or their freedoms. Some people believe that this is a political issue, and they're unwilling to wear a mask because they share the same beliefs with others. Some people think it makes them look weak if they wear a mask. Psychologically, some people think that wearing a mask means admitting a fear that they've not consciously thought about yet. To compensate for the fear, they reject wearing the mask completely. And some people find wearing a mask uncomfortable and are just not willing to sacrifice their comfort. I personally have been through most all of these stages when it comes to wearing a mask. In the beginning, I didn't really think it protected me. I didn't want to be mandated to wear a mask, as I too like my personal freedoms. And I also began to wonder what the chances were that this whole virus was somehow related to this year's presidential election. In the beginning, the mask was uncomfortable. It still is. But my perspective is different now than it was several weeks ago. Now, with more information and research, I'm willing to wear a mask in public because evidence has shown that the mask does help with the prevention of transmission from person to person, especially because statistics now show that many people can have the virus without even knowing it. My desire is to help stop the spread of the virus so we can get back as close to normal as possible. Also, as a healthy adult, I don't want to unknowingly carry the virus to older people that I love. So what I initially saw as a sacrifice now seems like an obligation to those around me. I totally agree that face masks are effective in helping to prevent the spread of COVID-19. So I'm going to do my part. Have a good day.